feel free to come on, take a seat. It's okay to sit down got a couple seats in the front row. Don't be afraid of that. So, okay, well, good morning, everybody. Again, hello, I'm Jim Dover. I'm the President and CEO for Sparrow Health System. I want to welcome all of you to our beautiful gathering place here at Sparrow. We're so grateful to be joined by our colleagues from Michigan Medicine who ventured north from Ann Arbor through the rain, and our many Sparrow caregivers and leaders, and we're excited to talk about this project today. We are implementing phase one of the agreement, a joint venture involving our pediatric service line that will ensure young patients and their families have access to specialty care options here at Sparrow, close to home, right here in Lansing. We're very excited about that. Our goal is that local families not have to leave the area for tertiary or subspecialty care. And this is one step in making that happen in a long journey that has been started some time ago, and also we will continue. As a father of four, I want all of our children in our community to be able to stay and be near the important people in their lives. But beyond that, another feature of our relationship with Michigan Medicine is our enhanced partnership with Physicians Health Plan. Some of you have heard me talk about the space in which we operate as an integrated delivery system, as a community-owned health system, and it's not only in giving direct patient care, which is the core of what we do, but also making sure that when someone joins the Sparrow family, they're part of our complete continuum. Part of that is with Physicians Health Plan, and Michigan Medicine will be joining PHP, making it more essential in today's region. This will help PHP continue to touch the lives of many more people in the coming years during a time of tremendous growth throughout the states, and also the state's Medicare population, as we are now launching our new PHP Medicare Advantage plan that is effective and open for sales on October 15th. Is that right, Dennis, to keep me legal? So, thank you. I see this relationship with Michigan Medicine as complementary to our many important other collaborations we maintain. I've been asked this question in the past about what does this mean for other relationships. We have long-standing relationships with Michigan State University Medicine. We have relationships with Mayo. We have relationships with many other organizations. And I'll say again what I've said before. When it comes to patient care, the color of the jersey doesn't matter. As long as our patients win, we all win. And that's what's important in terms of care for our patients that we are here to serve. Many organizations choose to partner with Sparrow because of our standing in the region and the care that we give to our patients and our long history of making sure that all care is delivered locally, that can be delivered locally. We don't like it when patients have to travel elsewhere, and so this new partnership with the University of Michigan allows us to continue in that focus and in that mission. So I'm now proud to introduce, as the next speaker, Dr. David Spallinger. Dr. Spallinger is the president of the University of Michigan Health System in Ann Arbor, has long history with them as well as other parts of the country. We actually know people together, right? We know others. And so really we are very blessed to have him come up today and join us for this. Please join me in welcoming Dr. Spallinger.
Well, thank you. So we're here to formally celebrate a milestone in our collaborations together. A formal agreement is important, but there's been a lot of work that has got us here today. And it's worth celebrating all the work of all the people in this room as well as outside this room who put this together. But more importantly, it's important to celebrate and envision what we can accomplish together, because I think that's what we're hoping for, is that our families and the people we serve will be the beneficiaries of this collaboration. Michigan Medicine and Sparrow Health System have had a long history of successful collaborations, particularly in pediatric care. Our affiliation agreement this past spring formalizes an already strong partnership, and it's been incredibly gratifying to see the progress that we've made over the summer. As people in many levels of our organizations have rolled up their sleeves, worked together, created a shared vision of providing care in this community for our pediatric and families. But we have a number of joint committees that have begun working in the past several months to explore ways that we can best serve our communities and expanded access to services through dedication to the very highest standards. We have a shared vision, and that is to be able to provide the highest quality care, tertiary care here in Lansing. That, the value of care that we provide is, some people define it as outcomes over cost and appropriateness times outcomes, but part of that appropriateness is also where the care is delivered and trying to reduce the travel time for families. Thank you for being here today. I also want to introduce Steve Girton as our next speaker. He's the director of the Pediatric Intensive Care Unit and also medical director of Sparrow's Children's Center. Thank
you. Thank you. When I came here 37 years ago, Sparrow already had a very rich tradition of taking care of the region's children. 100 years ago, Sparrow built the first dedicated children's unit in this region. When the time came, Sparrow built the neonatal intensive care unit to serve the 8-county region. When the time came after that, Sparrow hired me to build a pediatric intensive care unit to serve the children in this region. When the time came, we separated adults and children and built a dedicated pediatric emergency room. And through a number of collaborations, we have always been able to provide a certain level of subspecialty and tertiary care. Not ideal, but the most basic tertiary care we have been able to provide. We've also forged relationships with the Ronald McDonald House in mid-Michigan, with Ellie's Place for Children's Grief, with the Davies Project to try to make sure that kids can make their appointments to our subspecialty clinic. We've also known that if we are going to succeed in the real mission, which is to try and make sure that kids don't have to leave this area, we had to have a quaternary partner. We had to have somebody who had the depth to be able to help us meet the needs of this community. We could not have a better partner. And it's not about the billboard value of being associated with a world-class university, or the billboard value, for that matter, of an internationally famous children's center, or even the fact that we will now have faculty working in our hospital taking care of our children who have a deserved reputation for excellence. It also has to do with what we've already found working with the University of Michigan and Michigan Medicine, which is that they've embraced this region as their own. They've embraced the mission of caring for children here in our community as their own. They've taken the time and made the effort to understand us and understand the patient population that we serve. We're going to continue to do what we've done. Children who come to our door, regardless of their ability to pay, will be treated for who and what they are. The sons and daughters of our neighbors, the sons and daughters of our friends, and the grandchildren of our extended families. But we're going to do it better. We will start to work right away on common protocols, common best practices, the ability to transfer seamlessly patients from one institution to the other and get them back so that their families can remain where their families are comfortable and surrounded by their extended family. You will see we are also going to make certain that access for subspecialty care in a timely fashion occurs over and over again, faster and faster, more effectively for the entire population we serve. And that isn't just the 3 counties, it's the whole region. When Sparrow Hospital built that dedicated children's unit 100 years ago, they made a pledge to this community. The pledge was that they would take care of the children of the community in the region. Michigan Medicine and Sparrow Hospital together have defined a new we. This is who we are now. And we are renewing that pledge. And the pledge is that with rare exception, the kids in our region, in the city of Lansing, in the 3-county region, in the 8-county region, those kids can be cared for close to home and around the families that they need and the families that they love. That's our goal, that's our mission, and it's a new we that is bought into that mission. I want to thank the members of the team from the Michigan Medicine who have been working actually for months to make this happen. I want to thank them for the respect that they've shown us, and I want to thank them for having embraced what we thought was just our mission. Now it is our mission. It's ours together. Thank you very much. I now get to introduce Ron Herschel. He's the section chief for pediatric surgery at the University of Michigan. He's also the associate medical director for strategic planning and business development of Michigan Medicine.
Thank you, Steve, and I echo all the comments of all the previous speakers. As the chief of pediatric surgery at CS Mott Children's Hospital, I and my pediatric surgery colleagues have been taking care of patients at Sparrow, patients and their families at Sparrow for 20 years, since 1998. What I have observed is that Sparrow and Michigan Medicine share the same culture, the same standards, the same goals, and the same desire to achieve excellence in the care of children. I've always said that our goal by being surgeons at Sparrow, and we've actually said this to each other, is to provide outstanding pediatric surgical care to the children in Lansing and this region. That's why we're here. And to provide that care close to home for their parents. But when children need more complex care and more resources, we want to provide a seamless ability for them to get that care at Michigan Medicine Mott Children's Hospital, and then to just as seamlessly come right back home to Sparrow and the Lansing region. And this joint venture will bring so many more children's specialists to Lansing, a genuinely wonderful thing for this community. And I'm so happy after these many years to see this partnership come to fruition. It really is a great combination. Sparrow, Mid-Michigan's premier health system, and Michigan's top children's hospital couldn't be any more perfect. So I want to thank all those, and there are so many, who have worked so hard to get us to this day. And thanks to all of you on behalf of the children and their families of the Mid-Michigan region for the incredible work that we will be doing together. Thank you.
So my son was 10 years old, and he had a hot appendix in Broomfield, Colorado, and then once he was diagnosed, I had to follow him down, and he was in the ambulance, and my wife and I drove following him to downtown Denver through traffic so he could get his appendix removed, okay, as a pediatric patient, because we didn't have those pediatric services available in the northwest sector of Denver. And I thought, I never want to have some other family member have that same sort of action. So I'm so thrilled on a personal note that our commitment to keep care local that is appropriate, that we can keep that care local with that level of expertise with University of Michigan, we're just thrilled about. There are a couple other thank yous I want to do real quickly. First off, I want to thank the University of Michigan people behind the scenes to make this happen. So Keith, you and your team, Joe, Paula, Alan, Karen on the Sparrow side, thank you for all your work on this to make this did not happen by accident, right? It was intentional. So thank you for all that detailed work. I do want to also thank the boards of directors for both Michigan Medicine and also for Sparrow. We have our vice chair of the board here today, John Parrish. When John called me and prior to my arrival, he was so thrilled. One of the two things he spoke to me about, John, I don't know if you remember, but one of them was signing this partnership with the University of Michigan, and you were so thrilled about this. This is before I even arrived. So thank you for the governing boards and the opportunity to go speak to University of Michigan's medicine governing board about this. Without governing board support, and we have two systems here that are locally owned, one by Michigan, the other by Sparrow Community, that sort of local governance is essential to make these things happen. So thank you to our governing boards for that. And then lastly, the last group I want to thank, second to last group, Marketing Communications, thanks for the food and putting this together and making this all happen. Doesn't happen by magic, so thank you for that. Wendy, Eileen, John, your team. And then lastly, if I could please ask any caregiver who has in the past or currently takes care of pediatric patients, if you would please stand. All right, let's give them a round of applause. Thank you for your care for our patients. In closing, I would encourage everybody, we have some new pens now, co-branded. Please don't leave the table empty when you leave, so please make sure you take your new pen as a hallmark of today's event. Thank you very much, and everyone have a good day.